Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Surface marking, and this is of the heart valves. So first is the pulmonary valve. So in pulmonary valve, the horizontal line is approximately 2.5 centimeter long, and it is over the superior border of the left third costal cartilage. The superior border of the left third costal cartilage. And what is the auscultatory area? Auscultatory area will be the sternal end. It will be in the sternal end of the left second intercostal space. Next is the aortic valve. So what's happening in case of the aortic valve? The aortic valve, the line approximately it is 2.5 centimeters. So you have a line which is approximately 2.5 centimeters, and this is long and it runs inferolaterally and to the right from the medial end of the left third intercostal space. So it runs inferolaterally and to the right is from the medial end. So it is on the medial end of the left third intercostal space. Now moving on to the auscultatory area. So auscultatory area, the sternal end of the right second intercostal space. So right second IC space. And moving on to the tricuspid. The tricuspid, it lies approximately 4 centimeters near the midline. So 4 centimeters from the midline, and it will be near the 4 centimeters long near the midline, just below the level of the right fourth costal cartilage. It is below the fourth costal cartilage, and it passes down to the right. Then auscultatory area, it is the left lower sternal border at the level of the fifth intercostal space. Lower sternal border. So it is at the fifth intercostal space. Next is the mitral valve. So mitral valve is approximately 3 centimeters long. It descends to the right of the left half of the sternum. Right of left half of the sternum and opposite to the left fourth intercostal space. So it is a left fourth costal cartilage. There is a fourth next to the fourth costal cartilage. Now the auscultatory area is near the cardiac apex. It is near the cardiac apex. To learn and grow daily like this, please do subscribe.